Bismillahir Rahmanir Rahim. Welcome to the second session. After we had a very hot session, number one, with the burning issues about immigration, radicalization, and gender, we are coming to a very quiet session on science and technology. As you know, science and technology are the best facilities for human to life. So anything done in science and technology is for the humanity and for the better life. The first speaker, Mohamed Eltoum, he is a consultant physician and came out with very interesting ideas and published these ideas in a book which is here. And I think this book is very useful, especially for young medicals in the developing countries, and in Sudan in particular, because we have horizontal expansion of medical education. We have so many medicals who is not well trained, so this book definitely will be of use in the Sudan. So I will invite Ahmed Eltoum to take 10 minutes, not more than that, to present his paper.
Yeah, I'm thanking the organizers for inviting me to introduce the book. What were the reasons why I decided to make this book? A major hospital, which is Omdurman Teaching Hospital. There wasn't any guidelines to advise the doctors about how to manage patients with fluid depletion or with electrolyte problems or with acute kidney injury. And it's sad enough to say that also there wasn't sphygmomanometers to manage blood pressure, and there wasn't also charts to record the blood pressure and temperature and pulse rate, the vital signs, which are very vital in managing patients. Again, there wasn't fluid charts to see, especially say if somebody has a high temperature with diarrhea, with vomiting. There wasn't even fluid charts. There wasn't facilities to do blood tests. And there was also, there is still very limited access to medications. This is on the local or on the Sudanese front, but globally there is a problem with fluids. As doctors, medical students, we were not taught well about intravenous fluids. Again, there is very limited also evidence-based knowledge about intravenous fluids, and whichever is understood and taught is not applied well. So that is why there is a lot of errors in managing patients with dehydration, with electrolyte imbalance, and with acute kidney injury. And in fact, this is very unfortunate. It's not only in the developing world or the southern part of the globe, it's also in the developed countries. It's a global problem. And this unfortunate teenager died because of excessive fluid administration. And he's a British, he's an English. Why I took the adventure, in fact, we do have history, and probably the very first pilot in the history is from that part of the world. The phase two is the literature review, writing, and peer review. By the way, do you know who is this pilot?
The British one.
This is the very first in history in the 19th century. This is Al-Abbas ibn Farnas. He's an Andalusia. He's the very first person to fly, and he used that device, and he flew for about, I think, 9 minutes or so. So this is, we've got history again. And it was a very, the literature review writing and peer reviews are really very painstaking, very long path, very hard work. And when it comes to the peer review of there are about maybe 11 or 10 articles. Every article you need to get it peer reviewed by at least 1 or 2 or 3 or 4 to just to give it the scientific value. And unfortunately, I'm sorry to say that it's a self-criticism, by the way. Nobody from the southern part of the world, of the globe, has responded, unfortunately, to when I submitted these articles to them to peer review them. And there it goes into, I mean, the academics will know the proofreading and designing and the printing. And the when it came to that level, then I know Dr. Adil Dafa'allah is a friend of mine, and Dr. Mu'izz, or Mr. Mu'izz al-Siddiq, they introduced me to Professor Alam, and I would really acknowledge Professor Alam's input in making this book. It is not my own effort, it is a collective effort. And I dedicate the book to my parents and to also acknowledge my mentors, Dr. Mason and Dr. Venkat Raman, and many colleagues and as pharmacists there, also Professor Alam, Dr. Adil Dafa'allah, and Mu'izz Siddiq. And I called it the ABC because it is really an ABC, which is that all what we need, to be honest, in the developing world, the developing part of the world. It is an ABC of the, as its name implies, intravenous fluids and the electrolytes, and you can get it also free on the website, and there is also some free hard copies. The chapter on IV fluids, again, just some historic perspective. Ibn al-Nafis is the very first person to describe the pulmonary circulation. And then followed by Dr. William Harvey, who again described the whole circulation. And that has paved the way of the concept of giving people intravenous fluids. And there was an outbreak of the cholera in the 19th century in Sunderland. And there is a doctor called Dr. O'Shea. He went to investigate the outbreak, and then following those investigations, a doctor called Dr. Lata, he produced the very first intravenous fluid, and very primitive way of administering the fluid. And in fact, of about 15, 9 of the 15, they survived the cholera outbreak at that time. And it's unfortunately, now this is the 19th century in Sunderland, the fatalities, and they did well, but we are still in Africa with still the cholera outbreak. The people are dying because of dehydration and malnutrition. So it is very unfortunate. And from that chapter, you have to know your science, and you have to be very vigilant when you. I'm not going to deal you with the types of fluids, the way of administering fluids, and so forth. The chapter on AKI, and that's acute kidney injury. An acute kidney injury is not a traumatic injury of the kidney. Is an acute. They used to call it acute renal failure, but the nephrology community has now agreed to call it acute kidney injury. It is just a disease, acute failure of the kidneys to work. And there is the ISN is the International Society of Nephrology. They did have an initiative to say that there should be at 0 fatality by 2025 of death from acute kidney injury in the developing world. And I hope this is this is a contribution towards that initiative. And when, if you can see it well, it says the acute kidney injury from the area where it came from, or just generally in Africa, it's not low. It's just because it's undiagnosed, unfortunately. So it doesn't mean that it is low in Africa. It is just undiagnosed, unfortunately. In fact, the conclusion is not answers. It are rather questions. It's how to overcome the barriers to medical care, how to even the disparities in medical care. Why are we in the southern part of the world not engaging in research and publications and even doing reviews? Just a self-criticism. And then where are the policymakers? Where are the politicians? And in fact, I put this yesterday in Google, and I came with hundreds of these cartoons about the status, unfortunately, in that part of the world. This is this is a cartoon I got from Google yesterday. It's very unfortunate, obviously. This is another cartoon yesterday I got from Google. Again, it's very, very unfortunate. The policing or the health service is not that important, unfortunately, in that part of the world. And also, I got this yesterday from Google. Again, it is really corruption. It's not the resources, it's not anything. I think it's just the political will, which we are lacking. I'm sure my colleagues will elaborate further than I'm just a clinician, so I'm not really a policymaker. I don't understand more than writing IV fluids or writing antibiotics for patients. And on the positive side, for me, writing the book or this book and the ideas from the peer reviews were very helpful for my own education, by the way. And it was very steep learning curve. And having said all this, I think hope is still there. The hope, which should be hopeful. This is obviously, this initiative is part of that hope. And I will really appreciate your comments and suggestions, especially the criticism and how to make it better for the second or the coming edition. And before we go to the questions and answers section, I would really want to thank everybody for listening and want to thank Professor Alam for his support all through the moral, the encouragement, and the financial support. Thank you to all.
Thank you, Dr. Mohamed. You have taken 2 minutes more. But your subject is very interesting, so we'll give you 2 minutes more.